The National CQUIN scheme, Preventing Ill Health by Risky Behaviours, Alcohol and Tobacco, offers the chance to identify and influence inpatients whose alcohol use is a risk to their health or who smoke. The CQUIN applies to community and mental health trusts in 2017 and 18 and extends to acute trusts in 2018-19. It is intended to complement and reinforce existing activity to deliver interventions to those who smoke or whose alcohol use is putting them at risk. With me here today are Celia Ingham-Clark, Medical Director for Clinical Effectiveness, NHS England, and Interim National Director for Patient Safety at NHS Improvement, along with Sanjay Agrawal, Consultant in Respiratory and Intensive Care Medicine, University Hospital of Leicester, NHS Trust, and Michael Glynn, Consultant Gastroenterologist Hepatologist from the Royal London Hospital and Barts NHS Trust. Celia, could you tell us what a CQUIN is and how this one came about?
CQUIN stands for Clinical Quality and Innovation Framework, and what it's about is trying to incentivise specific things in order to improve the quality of care for patients. This CQUIN came based on NICE guidance on improving people's health by helping them to quit smoking and reduce excess alcohol. And what it involves in practice is where people are admitted to hospital, they're asked systematically about their smoking and drinking habits. If they're thought to be at risk, they're given brief advice there and then, and they're signposted to services to help them improve their health behaviours. This has an impact for them themselves, but also for the health service. And as part of the 5-year forward view, this will contribute very substantially to making a radical upgrade in the prevention programme.
Right, so the potential for a step change, really.
Yes,
yeah.
And also, of course, the opportunity to save money for the NHS.
Yeah, great. Michael, we know from ONS data that around 1 in 4 people are drinking above the CMO guidelines and put themselves at increased risk of harm. What level of harmful drinking are we talking about here?
So the current CMO guidelines were introduced only a few years ago and are rather lower than the previous ones, just 14 units of alcohol per week, both for men and women. That is quite a low level, and most people drinking above that level will not have a clue that it's harmful to them, and they won't know the wide range of health conditions that it's relevant to, not just the traditional liver disease, but also high blood pressure and quite a wide range of cancers. So it's about identifying those people and introducing a brief intervention which can be delivered by a range of health professionals, and these interventions are effective, and what's more, they're known to be more effective if they're delivered at a time when the person is engaging about their health in general.
Right, thank you. Sanjay, as a respiratory physician, why do you think you're well placed to offer advice and support to those with a tobacco dependence?
Well, we know hospitals are a place that people who smoke use frequently. There's over 1 million episodes that involve smokers each year in English hospitals, and 1 in 4 people admitted to hospital are smokers. So it's a great time to intervene and really treat tobacco addiction. Most patients who are admitted to a hospital expect to be asked and to be treated for tobacco addiction, but we know from recent data in hospitals that only about 1 in 4 patients are asked if they'd like to quit, and only 1 in 13 are actually referred for treatment for smoking and tobacco addiction. We also know from recent studies that we can actually cut mortality within a year, as well as emergency admissions and readmissions to hospital. So really it's a win-win situation for everybody if we can treat tobacco addiction in hospitals.
Okay, thank you. Michael, the CQUIN calls for the identification of risky drinkers and delivery of brief advice to hospital patients. What is in place to support trusts and their staff to deliver this?
Well, there's a lot of training available, both face-to-face, but particularly online training, which trusts can access relatively cheaply, if not completely free. And they will need to do that because a very wide range of staff will need to be trained. And the other thing trusts will have to do is to put in systems to record that this has happened and what was the outcome. But that's very similar to what they're already doing for every hospital inpatient, which is to assess the risk of venous thrombosis. So the systems and processes will be very similar, the trust will be used to it, And all of the staff hopefully will be engaged, particularly because they will be contributing to the patient's future good health.
Okay, thanks. Sanjay, what would you say is the role of local authorities in supporting the CQUIN initiative?
So local authorities commission stop smoking services, and it's those stop smoking services that we need to be based in hospitals to treat our staff so they know how to approach patients about their tobacco addiction and set up referral pathways. In addition, we want those stop smoking services to be accessible for hospital patients whilst they're in the hospital and also once they're discharged to the community. And we want to make sure that local authorities can provide patients who are admitted with an appointment upon discharge so they can continue their treatment for tobacco addiction when they're discharged from hospital.
Right, thank you. And Celia, what is the potential contribution to the NHS improvement and sustainability from implementing this CQUIN effectively within acute and mental health trusts?
This CQUIN, where it's implemented effectively, will actually help the individuals because it will reduce their chance of readmission to hospital with things like COPD or acute alcohol problems. It will also help the individuals in the long term because it will reduce their cardiovascular risk and even their risk of cancer over time. But there's an additional benefit for the population because if people are no longer going into hospital with problems associated with smoking or unhealthy drinking, then that frees up beds in hospital for other people. There's also a benefit in the elective care pathway where people are considering surgery because we know that people who smoke or who drink excessively tend to have worse outcomes from surgery, whereas if we can help them to quit before their operation, then they'll have a better outcome.
So thank you, Celia, and thanks to our panel, thanks to everyone contributing this morning. Health Matters will pinpoint the evidence we have for this CQUIN and the resources that PHE has developed to help trusts make the most of this important opportunity to deliver brief evidence-based interventions to support patients' health. Delivered well, we can expect to reduce the number of people who smoke and the risks that are associated with alcohol consumption. This is good for patients and good for the sustainability of the NHS. So do please take the time to explore this edition of Health Matters, which includes recommendations, case studies and supporting materials, including downloadable infographics and slides that you can use in presentations and in discussions with colleagues. So we all have an opportunity to really make a difference. And thank you for watching.